I've been coughing a lot lately.
Me too.
And I...
You know what it is?
Could be the mask. Everything in my body doesn't like the mask. It's like
Carrie
an allergic
Quinson.
reaction.
Carrie Quinson. I can't wait to find out what kind of cancer I'm going to get.
It sounds like that. Yeah. Just focus on what's in front of you. Don't touch these photos.
Forever. I just did one live the whole life. And I was shivering. And the guy comes up. Coolest cucumber in Pittsburgh.
Hysterical. You see your card putting his camera towards that's the image we want to do.
Fine. Look at that.
Mm-hmm. You're gonna put it. I won't knock it over. I'll try not to at least. So after I talk, should I go to the right here because I'm gonna come back up?
Yeah, actually that makes sense.
Yeah.
That does make sense. You just want to make sure you get the image.
Yeah.
Everybody's good? Yeah.
The nice thing here is, I think I can be the tallest one of everybody, which is not normal for me. So, you know, it's usually the opposite, you know. Yeah, I tell you.
She should be, yeah. I was told she just got in the chair. She's a nervous wreck now.
Wait till she comes in. Oh,
I told you who she was, right? Ozzy Osbourne.
I think you should mention that in your.
It's a pretty cool thing.
I don't know if we should mention.
I definitely want to.
Because I think if he mentions
Ozzy Osbourne.
I have it written down.
I'll ask. Because that's a nice color.
It could be some really nice stories.
Yeah.
After when she's done, after she gets over the order reaction from the
No, she may want we should do
stories.
Do we have the consent from someone? Oh, really?
We have the consent. Yes, he should be serious.
We need
He
it.
said he filled it out.
Yeah, we need it. We don't need it right now. Got it.
Were you supposed to give it to us tomorrow?
Each of you speaks because they're kind of around right now. They're asking you to take turns.
Got it.
You got it.
I just might.
Either.
So I have a couple.
We're just waiting on a patient.
We'll say some really nice things.
Are the patients coming around this way?
Yeah, we'll cover it.
That's what I said. So you. It's not even 1 o'clock. It's right on the month. Also, what channels are here? The PR. I sent it over this morning and I spoke to the PA, to the room here. So I don't know if you have it. Somebody else, I just talked to Priscilla.
It's camera ready. The room is camera ready. Not people ready.
Camera ready.
I'm glad you got that. Make sure you got it. Wi-Fi.
Well, it's tiny in person. I don't know how you get doses out of that thing.
Joe sent us, I don't know why he's saying this, but he's saying, and all it is, the on-call person's not going to be able to take notes on
We
this.
don't need this, right?
But I don't know if he said
I
anything.
think that's from a member of the media.
Yeah. Do you want me to put it down here so you guys
No,
don't?
they
I
wanna
just
hear
want to
it.
put mine here. Oh, okay, I got it. That's Steve's. So let me just.
I'll just
leave
put it in
mine
the
there.
corner. Yeah.
Actually, I'm gonna.
This is mine. I'm going to report the conversation.
Okay, good. Okay, that's Steve's. I don't want to screw. Did I just screw him up?
I don't think you did.
Let's rewrite the notes.
Steve did that.
Put
You
them
know
all
what
out
I
of
do?
order.
I just know that we're talking about South Shore and we're talking about
Yes.
what we look like and how we were a hot spot and
Yes.
how everybody works.
Yeah, you want to focus on that. Jay will focus on the vaccine in general. And short and sweet. They all want to see the shot, so you don't have to talk long.
Let's get out of the way, guys. Thank you.
All right, show's over. Now you can breathe. So well. That's not what we were doing. Getting out of their chair, how like close up they want. Compliment.
You're used to this, though, right?
Yeah. Okay. Cool. I had to write it down. All right, folks, we're set to begin here. All right, good afternoon, everybody. Welcome to South Shore University Hospital. My name is Steve Bell. I'm the Regional Executive Director for Northwell Health, for the Eastern Region of Northwell Health. And today we're all here to really witness a huge accomplishment, the addition of a third vaccine that we think is going to add another weapon to our arsenal in fighting COVID-19. You know, in preparation for this, and over the last 24 or 48 hours, we've been thinking about the last year in which we've been battling COVID every day. There's a lot to go back and think about, but I'll tell you, when this started, there was really one weapon to fight COVID, and that was the hard work and the knowledge and the dedication for the healthcare community in general. Over time, over the year, we've added more weapons to our arsenal, whether it be therapeutics, whether it be monoclonal antibodies, whether it be now vaccines. And now over the last 3 months or so, we have been using the Pfizer, Moderna vaccines, everything we can get our hands on in collaboration with the state and local government to vaccinate as many people as possible. And we have vaccinated well over 100,000 people, over 50,000 of our own employees. And so we're excited to have another opportunity to expand our vaccination efforts, not just to the patients in the hospitals, to the broader community in general. You know, over the last year, Northwell has touched hundreds of thousands of patients, if not many more. We've touched them through testing, through treatment, and through, obviously, now vaccinations. And we're very proud of our efforts. If you were to go back and look, again, a year ago at this hospital, we talk a lot about being an epicenter of the crisis. A year ago in this hospital, as Donna's going to discuss, we used every open space that we had, every staff member, every resource we had to get through this spring surge of the COVID vaccine. And that hard work from the employees, from the staff, from the leadership team here allowed us really to get to the point where we are now. So, again, today's an exciting day. We have a safe, durable, effective single-shot vaccine. It's really going to help us to address some of the access issues that we've had in the broader community, as well as in our inpatient community. I'm going to hand it over to Donna Morovic, but just a few words about Donna, who's the executive director here at South Shore University Hospital. You can't underestimate the strain on a team, the frontline team all the way up to the leadership team, in dealing with the COVID crisis, not just in the spring, but all through the summer and now. Donna has done an exceptional job as an ambassador of Northwell Health here, as an ambassador of the community. Donna lives in the community. And the efforts here at South Shore Hospital, University Hospital, are nothing short of miraculous. The leadership team has been fantastic. I'm very proud that this is the venue in which we're doing the first Johnson & Johnson injection, because this team here deserves to be recognized for all the work that they've done. So, Donna, I'll hand it over to you.
Thank you. Thanks, Steve. Hi, everyone. Thank you, Steve. It's a really exciting day. Over a year ago, we were at 120% capacity here, over 327 patients to be exact. On April 17th, we're COVID positive with over 100 patients. You still have the patients who need their open heart surgery and their brain surgery. And we are the receiving institution for all of the other hospitals in the Eastern region. So we were the epicenter, and I have been in healthcare for 40 years as a nurse and an NP. And what I've seen here, I have never seen before. And what was probably the most difficult thing was when you go home and your family's there and you can barely tell them what your day was like. The other thing is seeing families who are visiting with an iPad was horrible. So to be the first hospital, not only that, but the newest tertiary of our health system, South Shore University Hospital, to receive the Johnson & Johnson vaccine is a really big deal. And I absolutely met our patient, who's adorable, and I'm really excited that she will be the first patient to get this. But I do want to say one thing about healthcare heroes. Anyone who entered this door over the past year has been a healthcare hero. I don't care if you're environmental or a neurosurgeon. You are a healthcare hero. So, again, I just want to thank all of you for being here. I want to thank our patient, and I'm delighted to have the newest tool in our armamentarium, Johnson & Johnson single vaccine. I'd like to introduce our medical director, who's going to give you more information on Johnson & Johnson, and that's Dr. Jay Endon. Thank you.
Thank you, Donna. And thank you, everyone here, for coming today. So I'm going to speak a little bit about this new weapon in the fight against COVID vaccine and what it's going to mean for us. So we clearly have a new and powerful weapon that will transform our options. This is a single dose vaccine, and each shot is a full inoculation for COVID. There's no need to book a second appointment. There's no need to worry about supply chain that will afford enough. That's important. That takes precedence. That will afford enough supply for us to be able to choose between having one vaccine of two and when we're going to get the second vaccine. So the data available for this Johnson & Johnson vaccine is powerful. The data suggests that it is 85% effective in protecting against severe COVID infection and 100% effective against hospitalizations and death. That is across multiple countries and populations. That is powerful for us. Its overall efficacy in the United States against a moderate to severe COVID was about 72%, but again, no one progressed to requiring hospitalization, and no one, fortunately, died. There is some new science behind the J&J vaccine, but its development does follow a much more traditional path in the sense that it is an adenovirus-based vaccine which uses an inactivated form of the virus to trigger an immune response. It contains a DNA code for the COVID capsular protein. However, remain assured that no one can get COVID from this vaccine, and no one can get an adenovirus infection from this vaccine. They can get protection. So the information suggests that this vaccine offers strong protection against severe and deadly cases of the disease, and most importantly, it limits the number of hospitalizations of those infected with COVID. And that, by the way, includes the UK and South African strains that have been circulating. But this represents a pivot point for our patients. Before today, eligible non-vaccinated, non-COVID patients who are discharged must recover at home and then begin the arduous process of trying to find a place to get a vaccine, trying to get an appointment, trying to wait for the appointment, and then begin the 3 to 4 week period of time where they have to have sequential vaccines. Starting today, we can discharge these patients to their period of recovery, and at the same time as they recover, they can acquire immunity and protection. So, this offers a high rate of efficacy after just one dose, but it's also easier to store. And from a population health standpoint, this is critical for us. It doesn't need to be frozen, and we can keep it in a refrigerator for 3 months. This is an enormous step forward in our ability to increase the number of places that can actually store and administer the vaccine. Some of the expected side effects are very comparable to those from the Pfizer and Moderna vaccines. Some folks have fever, some headache, some fatigue, and muscle soreness, a small price to pay to prevent hospitalization and death. From our standpoint, we will offer our patients this vaccine in accordance with the state guidelines for who is eligible, and we are unbelievably excited to continue this opportunity to fight in the final stages of our war against this pandemic. And with that, let me reintroduce Steve.
So really what everybody's here for is our lovely patient, Susan Maxwell-Trumbull. She's recovering from a total hip replacement here in the hospital. Very happy that she agreed to volunteer to be the first recipient of the vaccine. I think the lights and cameras are nothing new to her. She's had a career in show business. She was the agent for Ozzy Osbourne in the past, just an interesting fact. So, assistant agent. But I'm sure you have some good stories. Yeah. And Janine Mucci, who is the nurse who's going to be administering the vaccine.
All right, guys, we're going to take a minute just to set up here. I'm going to put the mic on to the side for the moment, and after the vaccination, I'll move the mic closer so she can talk to everyone. You want to show your vaccination card? She doesn't need a second dose, so she doesn't need to look at the card again.
Well, certainly, first of all, I want to say how thankful I am to Dr. Keith Reinhardt, my orthopedic surgeon, and his associates, and South Shore Hospital for giving me this opportunity. I have compromised health, and I haven't been out hardly ever, and this will afford me that opportunity, so I'm very thankful.
How do you feel right now? Any side effects from the shot?
Not yet. You want to call me tomorrow, I'll let you know.
And your emotions right now?
I'm excited, because I've been wanting to get the shot. I wasn't really sure where to go and get it, and I was just really surprised when they came to me and asked me if I'd like to get the shot. Yes, definitely.
Did it matter to you what shot you got?
Not really, no.
Why?
Well, I talked to my primary care physician, and she had was it Moderna? Is that it? So I was looking to do that, but this opportunity just came up, so I took it.
How does this compare to the hip replacement?
Well, this is nothing.
And how, in terms of your life, how will this impact your life moving forward?
Well, again, having been housebound for quite some time and not being able to go out because, again, I have compromised health, it makes me feel that I can go out now, still wearing a mask, but at least I can get out and do a little bit of food shopping and taking some of that responsibility off my husband.
Can you tell us a little bit about yourself? Are there people you haven't seen, I don't know, family members, or what are you really looking, aside from grocery shopping, what are you really looking forward to doing and getting back to the so-called normal?
Well, my sons would come to visit me and they'd have masks on. They would mostly come to me. I wasn't going out very much. If I did go out for doctor's appointment, I'd always have a double mask, so it just frees me up a little bit, nothing spectacular. I'm not going on a vacation or anything. It's just, it frees me to go out and feel comfortable, which I will still keep myself covered with the mask and my gloves I usually wear.
And to the millions of Americans who are jealous of you right now?
Don't be. But, take precautions. It's the one thing that bothers me when I see people that feel they don't have to wear a mask, or, and I always say that if this were leprosy and you could see it, everybody would be wearing a mask or doing what they needed to do, but you can't see this. So therefore, to some people, it's so what, So I'm hopeful that we can get rid of this pandemic very soon.
And where are you from on the island?
Babylon Village.
Babylon. And you didn't have COVID, you haven't had COVID?
No.
And your previous job was?
Well, there's a number of them. Right now, I have a TV show on cable, Channel 20, 10:30 Wednesday mornings. And it's a guided meditation stress-reducing show. I did 10 years in the music industry, and that's pretty much my history.
What do you think of all of us watching you here?
I'll be honest with you. Having been in the music industry, I had a number of interviews with Rolling Stone, and Cosmopolitan magazine came to interview me on some of the work that I do. I was really nervous, but for some reason I'm very relaxed right now. I'm not shaking at all. Thank you.
We're an easygoing crowd.
You are. It was a shock, as well, Val.
Everyone says he did
I'm fine.
marvelously. Thank you so
thank you.
much for this.
Thank you.
Most importantly, now you can go home and, as I said, recover and
Yes.
acquire immunity at
Yes,
the same time.
yes.
So that's great.
I feel great. Thank you so much.
Can you put this on your finger and just hold it up for a second?
That?
Can you just hold it up for a second?
Certainly.
Wait there 1 second.
that I'm actually so protocol. I just have to keep an eye on you for 15 minutes. It's
Okay.
normal standard
Sure.
for all vaccines. So I'll be with you.